Politicians and celebrities make deals behind closed doors, promises broken, and their income soars. Hidden agendas run the grand parade, in the circus choose a masquerade. Believe me, I wouldn't lie. I've been given money, power, and fame to keep you in line.
Welcome everyone to the show. Ignore the background. I'm doing some remodeling. I am here today with Rose MacKenzie, and we are going to talk about a really cool, interesting device. It's called the Mira, and it can track your cycle because, I'm always talking about doing like the Dutch test and all those things so that we can like get to know like what's going on with our cycles and notice things. But now we can do this at home, and it's way cheaper. So before we begin, could you give us a little bit about your background and how you got involved with Mira and what you do?
Sure. Yeah, of course. So I'm a fertility awareness educator or natural family planning instructor. I'm trained in multiple methods. So my background is symptothermal, and then I'm also trained in Marquette. So those are all methods where we teach women how to track their natural biomarkers to find when they're fertile, when they're not. And that can be used, of course, to achieve a pregnancy, avoid a pregnancy, or charting for health, which is how I ended up with Mira. So really the Mira device can be used for women who are looking to optimize their health. And my role at Mira is assisting providers using Mira in their practices to help women who may be struggling with infertility or managing their PCOS, endometriosis, heavy painful periods. I like to say anyone who has ovaries has fluctuating hormones, and we can track that.
Awesome. So like, what are some benefits that you can have from tracking your hormones, and how important is it for women to do that?
It's critically important because our hormones affect every part of us, whether it's how we feel with like our emotions, to how we metabolize, and how we sleep. Everything is affected by our hormones. So we know for a woman in her reproductive years, the optimal health is for her to have regular cycles where she's having a normal bleeding pattern, an ovulation, and then she bleeds again. And so there's been a lot of, we'll say, push or new trend where women are choosing to not be on any type of contraceptives and to remove hormones from their lives. And we're really seeing that have tons of benefits because we know birth controls have negative side effects. And so many women are turning away from them and coming to more of a natural way that supports their body's natural function.
So, women can use this to prevent pregnancy, not just see when they can conceive.
Surprise.
Wow. Okay. I love this. Okay.
Yes. So if someone wants to use the Mira monitor to avoid a pregnancy, then they should learn with an instructor. Like I am an instructor, but there are many of them out there who will teach you how to understand your biomarkers, what days you have a chance of pregnancy on, which ones you don't. And you can time intercourse to either target for conception or to avoid a pregnancy. So that is, there's been fertility awareness instructors for many, many years. But again, we're seeing this big shift where many women are seeking out these resources and they never even knew that they existed, but they've actually been there the whole time.
Wow. So I love that. I didn't even think of that. But now, yeah, I'm going to be telling people this is a great option instead of birth control. All right. Yeah. So let's see. How reliable is it to track whether or not like you can get pregnant? Is like if you had to like guess a percentage?
Oh boy, we never want to guess percentages when we're talking about conception. But what I can talk about is the technology that Mira uses. So there's other solutions that have been on the market. So women typically know about LH test strips, for example, or the Clearblue monitor. And those solutions that are currently on the market use nanogold technology, which many women can recognize that because it's looking for a darkening of a line. So like a pregnancy test, an LH test strip, you watch a line appear. Whereas the Mira monitor uses immunofluorescent technology, which is the same as a laboratory. So when you mentioned Dutch, it's as accurate as a mail-in lab such as Dutch. So the results you're getting are high caliber, the most accurate thing you can do currently at home.
Okay, so that's great to know. And it's so much more affordable than the Dutch test. And you get all these parameters. That's great. Okay. Let's see. Are there any supplements or foods or anything that you shouldn't have around testing time?
Sure. So since Mira is really meant to be an ongoing, there's really not a lot of limitations or contraindications, but you have to know how those things might affect your data. So for example, if you're taking a bioidentical progesterone, that will significantly increase your serum progesterone, which then increases your urine metabolite of progesterone. So the Mira data would pick that up. And so typically women on oral progesterone or vaginal or injectable progesterone, I can immediately see it from their chart. So things that are more indirect, such as a DHEA or pregnenolone, things like that. Again, you just need to know how they're going to affect the data. So typically we're not having people stop their current treatment. We just let them know how it's going to affect the data. The only true contraindications are methylene blue, which some providers use for detox, and then high doses of biotin ongoing can affect the data. But those are the two main. Other than that, we say it's important for consistency to always use a first morning urine because we want this to be comparing apples to apples. And so comparing first morning urine to first morning urine, and that is actually the standard of care, like researchers who are doing research on women's, anything related to women's health, like if they're doing painful periods, or we have researchers doing things on athletes right now, or menstrual migraines, they're almost all the research uses first morning urine in laboratory settings. Now they're using first morning urine at home setting with Mira. So it's an exciting time, but it is important to know that we recommend a first morning urine for consistency.
Okay, so that was going to be my next question. When should you take it? Does it matter if you wake up a little bit later in the day? Does your schedule kind of matter?
Yeah, so the time frame does not matter. We typically say first morning, but though there's people out there that work second shift, third shift, and so really it's after the longest period of sleep. It doesn't have to be the actual morning, but the goal here is to obtain a concentrated urine sample. So most people, while they're sleeping, are not eating and drinking, and they're having a longer period in between in between urinating while they're sleeping, and so it's a very easy habit forming is once you wake up, collect your sample. But of course, we all live in real life, and you might get woke up by a pet or a child, or something happens. Maybe you're flying that day, and so you have to get up earlier than usual. Just simply collect your sample after at least a 4-hour hold. And that's usually very obtainable for people. If you do get woke up in the middle of the night, you can collect your sample. I tell people, you get woke up at 3 a.m. and you're not sure if you're going to be able to go back to sleep or what's going to happen, just collect your urine at that point. You can test that sample. If you then get to sleep a longer period of time, another 4 hours, you can test that later sample. So there's flexibility there.
Are there other apps that work the same way as Mira? And can you explain how they're different and how period tracking apps can help?
Oh, yeah. So that is its own can of worms there, asking like period trackers, because there are so many options out there. But the distinct difference between the Mira app and the others is it Bluetooth connects to the device. And so each time you test, then the device will Bluetooth to your app and graph the data for you. So that's the biggest difference. There are other hormone trackers out on the market. Of course, you can find them. But again, all of the other solutions use nanogold technology. So it might use like a smartphone to try to read that test strip, but it's really looking for a darkening or a lightening of the line. So the more accurate, specific data. I like to say the raw quantitative data. We don't smooth out your data. We don't try to make it easier to interpret. There's no manufacturer thresholds. It's just your hormone data, which, if we're being honest, can sometimes be a little bit confusing to people, but it's also exactly what patients deserve to see is their own data. Think of it kind of like a continuous glucometer, or if you're tracking blood pressures at home, what we're trying to do is empower people to have their own data in their hands.
I love that. So would you say it's about as accurate or more accurate than tracking things like cervical mucus, your basal body temperature, things like that?
Yeah, so I came from a symptothermal method, which is cervical mucus tracking and basal body temperature. So I still love those biomarkers, but they are indirect. So a mucus pattern, for example, is your indirect measurement of your estrogen, and your basal body temperature is an indirect measurement of your progesterone. And so they still have a place, and they can be combined with the Mira data. And they're really just, I like to say, we're taking you from a 2D on your hormones to now we're 3 or 4D looking at your hormones.
And if someone is completely new to
Mm.
hormone tracking and they don't know where to start, like what should they take when they're getting married? What are they supposed to be looking for?
Sure. So all they need is the analyzer and a pack of wands. They start collecting their firstborn urine sample, dip that wand, put it in the machine, and it starts graphing it out for them. It's as simple as that. They don't need to be on any phase of the cycle. They don't need to wait till their next period starts. The device will simply read a test strip anytime one is inserted. The only time we don't recommend testing is during the actual menstrual flow, but any other day they can pick it up. So what's really nice is this is not, we talked about Dutch. There's pros and cons to Dutch. But the Dutch cycle mapping, for example, you have to wait until another period starts and then do the very timed specific testing for that. So what I see many, since I teach providers, I see many providers doing Mira as the initial, like get a patient started. We can actually gather data before a patient has even like seen a provider. They can be on the wait list or waiting for their appointment in 3 weeks, and they can already be gathering data. And then if they decide now we need to do something more in depth, looking at their cortisol, their adrenals, their maybe the androgens, then it might prompt another more in detailed test, such as the Dutch Complete. But the Mira is the get started right away and start collecting data. And so back to your question of, like what should a patient expect or what should they do? Just start testing. It's as simple as that.
Are there any like red flags or anomalies that you can notice in the data, and what should you be looking for in terms of that?
Yeah, so of course, hormones are, I like to say that they are more like a dance between multiple hormones. And so honestly, many times there can be problems, and you potentially already knew you had a problem because you had symptoms, or your data is the first time that you see, okay, things are not as optimized as they could be. That's when it's time to reach out to a provider who can honestly help you manage your hormones. And that is typically providers who have met with Mira already. So they have a provider dashboard to view your data. They have a provider discount code, and they have knowledge about what your hormones should be doing and how they can manage those. But there are lots of problem areas we can find. Too high of estrogen. We can see too low of progesterone. We can see too many days of bleeding. We can see a mismatch between those hormones. And so that delicate balance and dance that your hormones do, many women think that they can't do anything to improve that. That's what they have. Yes, I have painful periods. That is a lie. And that is something that you should not accept. So many times I see patients truly getting the help that they need and optimizing their hormones when they have this more specific data, because they have something very concrete that they can take to their provider. Even if they don't have a provider who's maybe trained in Mira, they can go to their provider and say, I'm concerned about, and they can say, I have heavy and painful periods. My Mira data shows I have low progesterone. And so they have like some, beef to their complaint, and they can advocate for themselves.
And what are some common maybe misconceptions that people have about tracking your hormone that you found?
Well, probably the biggest misconception that we see is women assume that they are supposed to have a 28-day cycle and they're supposed to ovulate on day 14. And that's not realistic. Everyone's cycle is different, and your unique cycle is your unique cycle, and your day of ovulation varies. And so that we see immediately when we have people come to us who are trying to conceive, and we can see that they're targeting intercourse on the completely wrong days. So they're targeting intercourse around day 14, and they actually ovulate around 19 or 20. And so they've completely missed the window. Since sperm live for 3 to 5 days, they have targeted on completely the wrong days. So really, truly finding out when they're ovulating. I see a lot of aha moments with women. They're like, that's why I feel that way at that part of my cycle, because our hormones do shift and they do change how we feel. So a woman feels completely different in her follicular phase versus her luteal phase. So the before and after ovulation. And there are some fascinating studies that are happening. For example, the University of Toronto came out with a study looking at women wearing a continuous glucometer, Fitbit, and Mira throughout cycles. And they can see that even the women's glucose levels are a biphasic, meaning their glucose levels before ovulation and after are completely different. And so that leads into, of course, our food cravings and how we're sleeping, and all of those things are, again, we truly are dynamic. As women, we are very dynamic, changing women, which makes us so interesting. One of the, feminine genius things about us.
So how can we kind of tailor a diet using Mira? How can it like help us?
Yeah, sure, sure. So, of course, there are trends out there about seed cycling or eating in a way that supports how your body is metabolizing. So, I am not a nutritionist, so I'm not going to claim anything I don't know. But I can tell you there is some really good nutritionists and functional medicine providers and those who truly help you with your diet, who can see what your body is craving, when and why, based on your Mira data. So just to give some quick chart examples, I had a provider recently who was telling me how, I was asking her, based on your patients, how long does it take you to see changes in nutrition? And she actually surprised me with her answer. And she said, depends what it is, but it can be as fast as one cycle. So her example she gave here is a patient who had really high estrogen levels on her Mira data. And so they did a deep dive in her diet, and they found that she was eating a lot of soy products. And so when they removed the soy out of her diet, within 3 weeks, her Mira data was drastically different. And so some things take a lot longer to see positive change. Like when I'm working with women to, let's say, improve their estrogen levels if it's too low, that typically takes longer amounts of time. But if we're removing, then we typically can see those things faster. So diet is definitely something that I think is many times overlooked. And really, the Mira data can be speaking to and telling you, yes, these changes that you're making are having a positive improvement on your hormone data. And it can also tell you if maybe you slipped off the bandwagon and your data gets worse again. It can be that honest feedback to yourself of how well you're doing. And that's related to, it could be diet, your sleeping patterns, your stress. Stress is something that I often teach women. Your body will tell you if your stress is not managed well enough, because it can, the body only has one way to prevent pregnancy on its own. One way to prevent pregnancy is to not ovulate. So when your body is under tremendous amount of stress, or it feels threatened in a way, or it's not getting enough calories or healthy fats, your body will say, right now is not a healthy time to get pregnant, so I'm not going to let you. So I'm not going to let you ovulate. And so helping women to understand that dynamic there, and how much we really can support our bodies and support our hormones to ovulate well.
And how can we use it to help with things like PCOS and endometriosis?
Yes. So sometimes the data can actually point you to getting a workup that tells you you have PCOS. So we can see this with abnormalities in LH levels. So someone with PCOS have what we call baseline elevated LH. And the problem with that is you're essentially overstimulating the ovary, like desensitizing it to LH. And so then it becomes harder for it to respond when it's supposed to ovulate. Other times we see too high of estrogen, or we see that long follicular phase where really the hormones are suppressed for a long period of time. And then finally the body starts its coordination like it's supposed to have. So that data, you can see where you're currently at. And then potentially that gives you a cue to, I need a bigger workup done. Or if you already know you have PCOS or endometriosis, you can see now, this is where I'm at. Now I'm going to do all these strategies to manage my PCOS. And historically, the only thing we really had to tell us we were doing better with PCOS was, are my cycles becoming more regular? But there are many women who have regular cycles who also have PCOS. And so that is not a sign for them that they're doing better, but their Mira data is. And so we can see the before, the during, the after. Am I making the headway I want to make? And not everyone responds the same way. So some women might, try what their friend did for PCOS, and it actually does not help them. And so they don't have to wait, let's say 3 months to see, okay, did this do anything for me? They can see that a lot faster.
Mm. And is there any support for interpreting the data with Mira, or do you have to go to a trained professional?
Yeah, great question. So many women learn a lot just from the app, because the app does give some simple instruction and interpretation for you. So many women, it's no fault to you if this is you, but don't know that the LH surge, for example, triggers the ovary to release the egg. That's not typically taught. Many women don't know that their estrogen level should actually rise twice. It rises, I call it the roller coaster. It's this rise towards ovulation, it declines, and then it has a second rise again. And so you can actually learn a lot by just seeing the graphs, seeing what the normals look like. And then, of course, if you see a problem area, I always encourage people to ensure that you're not hyper focusing on one data point, because hormones fluctuate. And so it's much more of a trend, especially if it's cycle to cycle. So for example, if I see a patient's chart where I'm concerned about too high of estrogen in their luteal phase, that's a huge, of course, red flag. But I want to see, does it happen again? So does this happen 2 cycles in a row? If it does, now I'm much more convinced that this is something we should target and improve. So from a patient standpoint, you can learn a lot from the app. If that's not enough, seek out a trained professional. And you can also book a coaching session with a Mira Hormone Health Clinic coach. They can help you interpret your chart, make some modifications like diet, lifestyle, sleeping patterns, stress. And then if need be, they can point you in the right direction of a provider who can do that bigger workup. So an ultrasound to look for PCOS, the blood work, and potentially refer you to a surgeon for looking at endometriosis.
And how can we help people who are going through menopause, perimenopause with the Mira app?
Yes. So perimenopause is something that is affecting so many women, and historically really did not have enough research, resources, even education. Like there's many gaps there in the perimenopausal transition. And women can go through perimenopause over very rapidly, like over 6 months, or potentially 10 years, 12 years. And so this is a huge area in women's health that we need to improve. And so where Mira is filling that gap is many women historically were able to get just a blood work from their provider, and it would show like a snapshot in time. So it would show, well, what is your estrogen right now and what is your FSH right now? But we know those are dynamic and they can shift from one cycle to the next. So in a perimenopausal transition, women can have a natural shortening of their cycle, but then they start getting sporadic and more random. And so if you get your blood work done on, we'll say, the wrong day, your estrogen can look very low when in fact, actually it tends to be much higher. And your FSH can be very changing as well. So these women are really being able to see their patterns and trends and seeing essentially how they're transitioning through this menopausal transition. And we know it's not only age. So it's also just their own pathway through perimenopause. So I'll have a 41-year-old and a 49-year-old. And the 41-year-old is actually closer to menopause than the 49-year-old. And based on their Mira data, I can see that. So I like to say it's the only time when dysfunction is actually physiologically normal. And so you see where the dysfunction is, which hormone is it, which one is high, which one is low, what's the combination of those together. And we're really seeing that this is allowing providers to truly care for their patients better versus just doing like a cookie cutter, well, you must be perimenopausal, you're 45, here's what I'll do for you. And we're seeing it much more of a tailored, individualized approach, and knowing that that can change over time as well. So a patient might get, let's say, started on something and they're doing great for 6 months, a year, 2 years, but then it changes. Well, that's when you can bring the Mira device back out. You can test again. You can see, oh, wow, my hormones have completely changed from a year ago. So I just touched on something that people probably didn't realize is you don't have to continuously test with Mira either. You can do 1 year in a row and then you're good. You take a break and bring it back out. So this really device is throughout the whole reproductive years. It can help you to avoid, achieve. Now you're postpartum and you're tracking the return to fertility, and then you can use it in the perimenopausal time. So it really is valuable in all of those situations.
Okay, so I think I asked you the main questions about the device as a whole. Now I want to talk about my results, because I actually took the Mira and I used it for like, after, I think it was like from ovulation to the end.
Mm-hmm.
So I found this incredibly interesting, and I sent this to my provider afterwards. She was floored. She was like, "This is amazing." So, like, I'm gonna be using this from now on. At least, like, because I see her, like, every maybe 3 to 6 months. So I think, like, the month before I see her,
Mm,
I'm gonna get this out so that I can send her this so she can see where I'm at, because things are gonna be changing. Because 'cause I'm old, I'm gonna probably be, like, in menopause at some point, so, like, things are gonna be all over the place, and yeah, so anyway, so this is, like, the first page. It says the
yeah.
cycle link, the period, the like, all these. Can you go over everything?
Yes, of course. So this
Okay.
is this is what we call as the generated report. So patients can generate the report within their app after at least one cycle. Providers can generate the report at any point. So from a provider standpoint, this can be really nice because let's say they're going to meet with you this afternoon. They generate the report, they can review it quickly, they can bring it up during the appointment with you, and then they can save it into your file for later reference. So it's super handy for providers. From the patient side, now they can see almost like a comprehensive analysis of their data. So the front page is a summary, and then it shows like their average cycle length, how long their periods are, their follicular phase, their luteal phase, and then it shows on the right-hand side, that's a depiction of that one cycle that you tracked. So let's say you had 12 cycles there, it would show them lined up next to each other. So this is the intro page. And then when you scroll down, you can see each cycle one at a time. Now, of course, there's outliers here. If a woman has a 60-day cycle, it will not fit on one page. So then it's 2 pages. But this page shows you, go ahead and go to the next page.
Oh,
It was
sorry.
there for a second. There we go.
Okay.
So this page shows you, it has the date and also the cycle day above it. So I can quickly see what day your period started on. So let's say I was a provider reviewing this. I can make some very quick interpretations. I can see that your period started on October 5. You bled for 3 days. You started testing on cycle day 14. And then I see that your cycle length was 28 days. So what's fascinating about this data is it's a graph. So those who are visual learners or those who really love numbers, they can actually see all the data points for each of the hormones that you tracked. And in your data, you were tracking with our MaxSwans, which tracks estrogen, LH, and progesterone. So the black lines are estrogen, the turquoise lines are LH, and the purple lines are progesterone. You could add in FSH monitoring if you wanted to. Those are our gold color. And women can track their basal body temperature on this graph as well. Would you like an interpretation of your data?
Sure, let's go.
So I can see that you started testing once your device arrived, and you tested here on cycle day 14. And we can see that your estrogen was already elevated, your LH was already elevated, and so was your progesterone. So what many people do not know is progesterone can spike or increase as a woman is ovulating. And then it declines, and then it has its final rise. So we actually caught you right at the ovulatory event or the LH surge that was triggering ovulation. So most women will have an LH surge that lasts for 1 or 2 days. Some people will have 3 days. If it's more than 3, I'm usually starting to get concerned about an abnormal type of LH pattern. So you had elevation on day 14 and 15. Now I can't say whether you were elevated on 13 or not because we don't have that data point. But with the data that I can see, I would suspect that you released your egg on cycle day 14 or 15. And you can see the Mira app has circled day 15 or October 19 as suspected ovulation. We then see the appropriate decline of estrogen after ovulation and then its second rise. We also see that progesterone then starts to have its gradual incline, and that's from the formation of the corpus luteum. So sorry to get really technical on everyone for a moment, but when an egg is released out of a follicle, that ruptured follicle comes back together and creates a corpus luteum, which then drives your progesterone up. So to see that someone has released an egg, we want to see high progesterone levels. So what I can see here is your suspected day of ovulation, your balance of hormones in your luteal phase, and we could also count out what your luteal phase length is, which helps us to see, is it a healthy length? For those actively trying to conceive, for example, We need enough days in between ovulation and your next bleed to allow the baby time to implant into the uterine wall, which typically occurs around 7 to 10 days after ovulation. And so if a woman's luteal phase is too short, then that process of the baby implanting may not be complete before the shedding of the lining has started. So that is a huge red flag if someone has a short luteal phase, and definitely something we should improve. What else do you want to know about your data?
I noticed that the estrogen kind of like towards the end kind of goes up and down a little bit. And then I also noticed that when it went up the day after, I would get like a menstrual migraine.
Ah, interesting. And so you've identified a symptom that seems to be correlated with a hormone. So this is a great way for you to trend. Does that happen on repeat your next cycle? And can you see which one it is? Is it the spike up or is it the spike down? Typically, women will get symptoms from a couple of different ways of what their hormones are doing. It can be a general too high of estrogen, too low of estrogen, or a fluctuation. So for example, many perimenopausal women will get symptoms because the estrogen is this bouncing around everywhere. And so it's helpful to know in your next cycle, is it around the same part of your cycle? And is it the same kind of dropping of the hormones? Anecdotally, I have seen when it's the dropping of the hormones, and typically both together is what we see, such as in your chart here, your progesterone and your estrogen were dropping. And that might be when you start getting symptoms.
So is that concerning, or that's just like, meh?
So it's one of those things where I'd want to know if it happens again. And then I'd want to see, is there anything that has worked for you in the past, or is there something you're willing to try? So usually when I'm working with someone, so let's say they complain of a lot of headaches in their luteal phase. So do I see an overarching problem like estrogen dominance, too early of a drop in the hormones? So my goal is always to optimize the hormones. And if we can optimize them in general and your symptoms go away, then I don't have to be as specific about one thing, if that makes sense. So I wouldn't want to go down, let's say, the rabbit hole of let's lower your estrogen and then that not be the best strategy. So that's my approach. Every provider can do that differently. But I look at overarching, have we optimized other things that support your hormones? So those lifestyle, diet, exercise, sleeping patterns. And has anything worked for you in the past? And if not, let's go ahead and start trying some things.
Okay, good. So I do know when I sent this to my provider, before that, like maybe a year or so before, I had done the Dutch test. So the Dutch test is very expensive. It's very complicated to do. You have to like time it and everything, and it's annoying. So I do that like not very often, maybe every couple of years, because it's so annoying and expensive. So she had that one, and then the rest of it we're kind of like doing the blood test. So we're kind of like guessing a snapshot. We don't know when exactly. We're kind of guessing maybe around this day of the cycle. Keep testing it. Like I think it's day 19 or something. And with that, we were kind of
just for a quick second.
Yes.
So when someone says to do blood work or a Dutch complete around day 19, 20, 21, what's actually optimal is what they're trying to say is 7 days after ovulation. Which for most women, if they ovulate, the myth out there, if they ovulate on day 14, then you do your test, around day 21. But if you ovulate on day 19 or 20 and you do your blood test on day 21, it's not going to be a good representation of what they were looking for. And so Mira can be a huge asset for, if you're going to do a bigger workup, to have it be more valuable and get more accurate information. Because a blood test of progesterone a day after you ovulate is not going to tell you what you're looking for. 7 days after ovulation, it's a very valuable test. Although many providers would argue that to truly see your health of progesterone, it's much better to see the entire luteal phase itself, because we can see things like a too mature of a drop of progesterone, for example, or we can see things like you might get a really nice level, and then it, instead of staying elevated, it drops and then stays like a lower level. So things like that you might not be able to see with just a one snapshot in time. So I'm so glad you brought up cycle day 19, or I typically hear it cycle day 21. It seems like
Mhm.
this magical day in the cycle, but truly the magical day we're looking for is 7 days after ovulation.
Okay. So good to know. But anyway, so the provider basically said, looking at this,
Hmm.
based on like what we were guessing with my symptoms and the
Yep.
previous test, she thought I was very low in progesterone. But then we see this and it's like, I don't think you're low in progesterone.
Oh, that's so interesting. So when I look at your data, I am not going to diagnose you, but when I look at your data, I'm actually more concerned about your estrogen levels.
Yeah.
So it would be much better for me to see the whole cycle all together, so like a future cycle. But typically, estrogen should be that, again, big rise, decline, and a second rise. When we see where the two, I call them hills, but the two hills of estrogen are similar, or when they're reversed, those are, again, identifying a problem area. And many providers will approach this different ways. Some will talk to you about, let's do a detox. Some will do supplements like DIM. Some will say, well, let's boost your progesterone even higher to try to balance your estrogen. So there are a ton of strategies that providers might do, and that's what they specialize in. But what the data is telling you is then how is it changing? So let's say this is where your levels are, and you and your provider decide, let's try to improve your estrogen levels. You can watch that change over time along with your symptoms. So it's always best to have that two prong of the data and your how you're feeling and your symptoms together to really paint that picture, because we are all individuals with different hormone patterns. And so of course we're shooting for an ideal, but your ideal might be slightly different than mine.
Yes. Yeah, I think her technique was because I always had high estrogen, always,
Hmm.
even though I like do the dim and all that stuff.
Sure.
It is what it is. I took all the bad products out. I changed the diet, everything. It's still high,
Hmm.
whatever. But I think it was like bring the progesterone up, maybe that dampens the estrogen symptoms. But I feel like that did not happen for me,
Bummer.
unfortunately. Yeah.
So you did not respond how she would like to see you respond, which can happen.
Hmm.
Um, I would love to do a deep dive with you to see what they had all found and what they've all tried. And of course, we don't have time to do this
Yes.
today, but it is definitely something where, your history tells us you have some issues with estrogen. Your Mira is telling you you have some issues with your estrogen. So we can see, some people have just very resistant, we'll say hard to manage hormones. And so you have to get a little bit, we'll say, thinking outside the box and get a little creative to help manage those well. So,
Exactly. And I found out recently that peas are very high in estrogen, like I think phytoestrogen, something like that.
mm.
I did not know about that, like almost as much as like soy and all those other things. I had no idea. And when I got with my husband, he was always, because it was like the cheapest vegetable, and he was always buying us peas. And I'm just like, why is everything getting bigger?
What is happening? Well,
Yeah.
that's what's fascinating about, we love like the continuous glucometer data, for example, because how one person responds is different than another. And so you might be very sensitive to, one person might be able to eat peas and be okay. And you might, your body might run with it. And it's like, that's something that you might have to completely avoid. So yeah, that's very interesting. I'd be curious if you experiment and, let's say, remove peas completely in your diet, or, do some things like that and see if your data changes. So
Yes. So the other pages, anything?
yeah, so this next page is showing when your period started and then you weren't testing. So it's blank, but if you flip down, there's another page. This is your distribution. So if you had multiple cycles, it would show you that your consistent cycle length is about this, or you have variability. And that shows your follicular phase, luteal phase length. And if you go to the next page, I actually love the next graph, because you can compare, let's say, 3 cycles, 6 cycles, 12 cycles, and you can see how you're changing over time. So let's say your LH looks great, but let's say it didn't. And you're really trying to manage that LH. You can compare multiple previous cycles to your current and see, am I shifting this? So this is LH. If you go to the next page, it's estrogen. And you can also see here the graph of the reference ranges, which I will be very honest with you, we're actually in the process of narrowing and improving these reference ranges so we can show not just not just gray, but like colors of, and providers get given this more specific reference ranges of, what's more optimized, what's more ideal versus just within our range, if that makes sense. And so you'd be able to look at this estrogen, you say, okay, this is where I started. Now this is where I am now. And you can see that progress over time in one page, which is really nice. And then the next page is progesterone, same idea. And then I think there's one more page, and these are all the data points themselves. So sometimes this is helpful, like if we have researchers or those who want to see exactly the data points in like an Excel sheet version. Of course, when we work with specific researchers, there's a whole process for that and how they can secure the data and also have it de-identified. So lots of good things Mira's doing with that.
Awesome. So I love the test. I think this is going to be a game changer. I think it's probably better than just doing the blood test. What do you think?
For many it is, because a blood test, again, can tell you a lot, but it's only a right now. And since we know that the hormones fluctuate within the blood, and they fluctuate like within the hour, they fluctuate. And so we're really getting a snapshot, this date, this time, this minute of what your hormones were. But because the urine metabolites are a breakdown of the serum, they're much more of a view over a period of time. And then you can compare day to day. Now, I have many providers who still want blood tests for various reasons. So we're not trying to replace blood tests at all, but they can complement each other really well. And just a quick caveat here really quickly, many patients get frustrated when they try to compare their blood test to their Mira. So I need to tell you a couple of things. First, the urine metabolites are a breakdown of the serum. And so truly, if you're trying to compare, you would have to do like your blood test at midnight and then compare it to your urine that following morning. And no one's doing that. And also they're measured in different ways. So a serum estradiol of 100 is not going to equal out to be a Mira of 100 on your E3G. They're not direct equivalents. But there are studies that show that they correlate well. So that's what we're looking for, is that correlation, that giving us real data. So just a real life example of that is, we have a case study done by a provider in someone in perimenopause, and she did blood work on cycle day 3 like they typically do. And the estradiol level was extremely elevated. And so she wanted to know, well, what is this patient day to day? And so she did have her start testing on Mira, and it was ongoing very high levels of estrogen. So she knew that this was an ongoing problem for this patient. Another one, you asked me earlier about endometriosis, for example. There's a surgeon, Dr. Sarah Peterson, who's done a webinar and a case study with us, who talks about how important it is that she has her patients track after their endometriosis surgery, because she wants to ensure that their estrogens are optimized so that they do not regrow their endometriosis back. And so this is not only a like before treatment, this is before, during, and after. And again, it's really going to change women's lives in so many ways. So again, back to your question of like, who should get started? How should I get started? There's really no barriers for this. You test it out, see if it provides value to you in any way, shape, or form. And now you can have that data for historical data, even if you take a break from testing and decide to test later on in your reproductive life.
Do you think that when young girls are going through puberty, this would be a nice way for them to track it so they can kind of see like how they feel,
Sure.
It's you're not, your life isn't terrible. It's your hormones.
Well, I will say that we currently don't have enough data on young girls to make any claims, but have I seen providers use it on young women? Yes. So actually just this week I met with a provider who had a patient come to her who was very anxious, depressed, and just really was not doing well with like PMS, PMDD type symptoms. And within one cycle, they were able to identify an abnormality in her estrogen and start doing a workup and again, doing those interventions. And the provider said it is like night and day, the difference in that patient. So can it be used for, back to my original statement, anyone who has functioning ovaries has fluctuating hormones, they can use the device. Again, I just have limited data on those younger girls.
Yeah, well, I think I would use it for my kids so that they can be like, "Oh, is the world sucks? Why don't you check your hormones and come back
Let's
to
talk
me?"
next week.
Yeah, or it's like, or like, remember when you ate that? Now look what your hormones did. I told you not to eat
Yes.
that.
Yes. Well, I
All
think,
right.
again, it just is eye-opening to everyone, just like continuous glucometer data, people's sleeping patterns, all these, all the biometrics that we're able to obtain now really is giving us an insight into, again, how we're all individual people with various responses. And so that's only going to improve patient outcomes.
Mhm. And I would love to see a world where we are automatically, cheaply tracking our hormones and tracking our
Mhm.
glucose and tracking our blood pressure, just like everything is in an app. And then you get an alert. You shouldn't have eaten that. Why didn't you go to bed early?
Yes, that feedback would be your accountability partner.
Exactly. And then we can never blame my genetics or my
Yeah.
this or, oh, well, this just getting older. Alrighty. So, I'm sure everyone who's listening, they want to get this product. Where can they go? What are the next steps? And I have a discount code if anyone is interested. I will put
Mhm.
that in the description. It's to my last name, Khatibi, 15 for 15% off your purchase. Is there anywhere else that people can go for more information? Follow you on the online?
Yes. So go right to our website, miracare.com. It's very easy to maneuver. Yes, there are different types of wands, but I always tell people you're not going to go wrong. Just choose some wands, start testing. You can always tweak it later and put in your discount code. And if you need help, so let's say you start testing and you're like, I don't know what I'm looking at. Don't just keep fumbling along. Look for, again, the type of providers that you're looking for. And I always say you deserve a second, third, fourth, fifth opinion. I don't care how many times it takes you to find a provider who truly wants to listen to you, not do any sort of gaslighting, and who are willing to look at your Mira data. That might take a minute, but if you need someone in between, of course, you can see one of the practitioners at Mira's Hormone Health Clinic. I happen to be one that does some of those sessions, but there's a great team. And again, we can do lots with you. I know many people think, well, what can you really do through telemedicine? It's amazing what you can all accomplish through telemedicine, especially with this data, because it's showing us what your body's doing in response to those interventions we're doing. So, and of course, if you need a referral to something in person where you can get ultrasounds done, endometriosis consult, things like that, those practitioners are a wealth of knowledge and can point you in the right direction.
And I would probably get this question a lot. How much does it cost? Does insurance
Oh,
cover
sure.
it?
Yeah,
Um,
yes, yes,
Health
yes. So
savings, whatever.
yeah, let's talk about the Mira product itself is HSA and FSA eligible. So you are welcome to use your health savings account. So put in your discount code first, then the remaining balance, use your health savings account. You can also do a subscription. So just like anything you subscribe to that reduces the cost, we do the same thing. You say you want a box shipped to you once a month. We discount that 10%. And then you can also put the discount code on top of that. Other ways to make this cheaper is many people think they have to test every day, but you can start spacing out your tests, especially once you have some good baseline information. So if we looked at your data again and looked at your luteal phase, you could test every other day in that luteal phase, and I would still be able to interpret what's happening. So if it really is, the cost is an issue for you, or you want to test long term, then start to limit your tests in the luteal phase, still getting a lot of data, but less amount of testing. Many people ask, does insurance pay for this? Unfortunately, only if you have a fertility benefit coverage, such as we currently have contracts with Maven and Carrot where they'll cover the cost. We're always looking for more companies who really, they value things that are empowering their patients to get better care. And so it's ever changing. So always check with your benefit coverage to see if they cover things like this. And I think that really covers, it's only a one-time cost for the analyzer. So it's really just buying more ones the more times you want to test.
Mm-hmm. So it's kind of like an Aura ring for your sleep. It's just for your hormones, and we need to
Yes.
track these things anyway.
Yes.
So,
Yes.
okay, it's perfect. I love it. It's a great product. I hope everyone gets one for yourself, for your kids, for your wife. Find out what's going on. Maybe you can
Yes.
put like a little alert for the husband. Warning, it's that time.
Well, there
But
is
anyway.
actually a partner version of the app. And so if you invite your partner, they can see your hormone data as well. So that can, my husband and I, it's a little bit funny. Sometimes he'll text me and he's like, your Mira data is saying you're really fertile. And I'm like, yes, I am. So it makes for sometimes a little bit of a joke. So, comical relief is sometimes good too. So.
Oh my gosh, that's adorable. I love it. I'm going to put my husband on the app then. Alrighty. So thank you so much, Rose, for coming on and sharing this with us. And everybody check out the description. I'm going to have all the links. You can follow Mira and get this device. It's great. If you have an Oura ring, you need this one too. If you track anything, you need to be tracking your hormones. So thank you all
I
for
will
being
let
with
you
us.
know if you did not see in the news that there is a partnership between Oura and Mira. So good things to come. Yes.
Oh, I love it. That's great. They finally have an Oura ring in my size because my fingers are too tiny.
Oh, I see.
I had to wait years.
Well, like anything, it's always better things to come in the future. So the partnership between us and Aura is going to be amazing. And just, if you already are using Aura or you're using Mira but not Aura, both things have really great features and you're going to love them both.
Awesome. So thank you so much for being with us. Is there anything else you'd like to leave the audience with before we go?
Oh, I don't think so. We covered so much really good information today. So thanks for everyone listening. As you hopefully can tell, I'm very passionate about helping women and really empowering them to understand their hormones and live to the fullest by optimizing those.
Well, thank you all for being with us.
Thank you.
Start the revolution, let the truth begin. Wake up, they're feeding lies. Control the media's got you hypnotized. Trust authority, they'll take your soul. Break the chains, find your own control. Wake up.